Hi, everyone. I'm John Kenlon, Senior Vice President at Ensemble IQ and publisher of DSN. I am with Alex Hurd, all the way from Toronto, Canada. Alex is the VP GM Health at Walmart Canada. Thanks for doing this, Alex.
Thank you, John. Thanks for having me.
Yeah, so let's jump right in. A lot of our audience today is in the US. So first question, what can retail pharmacy in Canada do that it can't do in the US?
Great question. And, I've been in Canada now for 2 years, and it's been really fascinating to see what's happened in the market here. And so kind of the most impressive kind of development in Canada is that last year, all provinces approved pharmacists to diagnose and prescribe for what they call minor ailments. So this includes conditions such as UTIs or allergies or pink eye.
Mm-hmm.
Now, the type of minor ailments that pharmacists can cover is slightly different from one province to another, but it really helps to address some of the serious primary care shortages the country faces. And Canada is not unique, as you know, right? Kind of in terms of primary care shortages. And so, kind of as I stand back and just think about it from a healthcare system standpoint, I think it's a brilliant move, right? For three reasons. One, it addresses access barriers by leveraging who is arguably the most accessible healthcare provider in any community, right? And that's your pharmacist.
Mm-hmm.
Now, second, it allows for care delivery at a lower cost by leveraging the retail channel. And then third, it frees up capacity in the primary care system for more complex cases. So, Canada really is at the forefront globally in terms of leveraging retail pharmacy for healthcare delivery. And I think all of us can learn from the Canadian experience.
Yeah, so the Canadian system really is, at this point, a little bit ahead of the US, and it really is all about access, convenience, affordability, quality. So next question, in that vein, Walmart Canada is committed to accessibility and affordability, but it's also becoming more personalized. So talk about that, the personalization aspect, but then how a broad selection of health and wellness products, clinics, vision centers, and of course, pharmacy all get integrated.
We're on a journey, right? And kind of there's really a few steps that I highlight that we've taken over the course of the last 2 years to fulfill our mission, right, of enhancing access to affordable, personalized care. So first and foremost, we're leveraging technology to free up our pharmacy and our vision center team's time so they can take better care of our patients. And whether it's central fill, online appointment scheduling tools, a digital pharmacy app that allows patients to easily kind of refill and transfer their prescriptions or schedule home delivery, everything we do around tech is really kind of in service of our team so they can be there for our patients, right? Then we rolled out an initiative we call Moments of Care. And so Moments of Care was originally developed by the Walmart US health team in collaboration with the Disney Institute. And it's really all about creating meaningful interactions with patients that lead to enduring relationships. And it's really one patient and one moment at a time. And so then what we focused on is bringing together in like holistic solutions, kind of both the services, right, as well as our products, whether that's kind of vision products or OTC and supplement products. And so, for example, we're launching kind of solutions around women's health, seniors, diabetes. Diabetes is a great example. Nearly each of my pharmacies here in Walmart Canada has a certified diabetes educator on the team, right? And so phenomenal in terms of kind of really driving kind of an enhanced experience for our customers and our patients. And then we're launching a new health hub. So we're experimenting with a new concept. And here we're bringing together all of our health offerings. We're co-locating and we're creating an integrated customer and patient experience. So all of the services that we have, right, kind of the existing ones as well as new services. So we've just launched a pilot around a digital dietitian. We're getting ready to launch travel vaccination clinics. All of these solutions we're building so they can come to life both in the store and online. Now, underpinning everything that we're doing kind of from a strategic standpoint, everything is really anchored in affordability. And Walmart's timeless kind of everyday low price proposition, right? EDLP. And kind of whether it's kind of the breadth of the assortment from prescription medicines to kind of eyewear, healthy food, exercise equipment, kind of, it's all under one roof, right? At everyday low prices. And then kind of we, as you know, John, we do the wellness days, right, in our communities, and we offer kind of free health screenings and consultations. So maybe I'll close and just kind of describing the vision, right? And so the vision for our team, kind of based on our mission, based on our purpose, right, which is enhancing access to affordable, personalized care, right? The experience we aspire to is to make healthcare at Walmart as easy as planning your next kind of weekly shop, right? And so you start your journey with us on your app, kind of you input your symptoms, and then based on your needs, you know, we guide you to the right level of care. And then you as a customer, you as a patient, you decide, do I want to see someone virtually kind of in the moment, right? Or do I want to be scheduled kind of in the next available store, right? That's kind of what we're working towards. And we're real excited, not just kind of about the destination, but also the progress we're making in fulfilling that purpose.
It's interesting, you mentioned senior care. I read a figure just the other day that said that by 2035 in the US, and I'm assuming Canada will be similar, 1 out of 4 people will be 65 plus. They will be seniors. So, you talk about skating to where the puck will be. Obviously, that's a huge demo. And you mentioned women's health. Of course, I think that has perhaps been ignored in the past or not given as much attention as it should have been. And then, of course, diabetes, we know that it's a huge problem and a huge burden on the healthcare system. So you're really concentrating your efforts in the right places, I think.
Thank you.
So you mentioned working with Walmart US, and you also mentioned, I think you said the Disney Institute, and really partnering, collaborating. So that's what my next question is geared towards. Healthcare is complicated. Nobody can go it alone. So talk about the trend of traditional healthcare providers and payers working more closely with retailers to leverage insights, the frequent touch points that they all can deliver on. And how does that help you deliver better care, more effective, more efficient? And finally, I know this is a long question. Where do pharmacists, where they have this limited prescribing authority, how's it working out? Do we have results yet that you can talk about?
No, 100%. And look, kind of maybe I'll start with, like, you're absolutely right. Healthcare delivery is complex and it takes an elaborate ecosystem, right, to provide care in the most accessible and efficient way. Now, retail health's great promise, right, lies within this massive potential to unlock preventative health services, right, and products that reduce the strain on the primary care system, kind of both in terms of burden and cost, right? And so we're by no means kind of replacing the important work the primary care system does, but instead it is working alongside, right, and doing what we do best to address gaps that currently exist. And so you touched on payers. We're working closely with kind of employers, health insurers on payer solutions that also reduce costs to payers, right? And an example I'll give, like we're doing some work here around virtual care and prescription drug coverage. And starting in May, all Walmart associates here in Canada can have up to 100% of their prescriptions covered when they use a Walmart pharmacy, right? So there's really kind of exciting solutions that we can also then bring to bear there. And then kind of your question is good around kind of team-based approaches, right? And so, in our business, we have 73 clinics through the Jack Nathan Health Network that are based in our stores. And we're working closely with them. They're primary care providers, they're specialty kind of care providers, to develop team-based approaches to provide just that best patient care for our customers and our patients. What I'll share kind of in terms of your question around what are we seeing in terms of kind of results from the minor ailment approach here in Canada. I hear a lot of stories from our team, right, where like late on kind of a weekday evening or on the weekend when a lot of the walk-in clinics are closed, right? They'll have customers come in and just to have kind of that access point that didn't exist in the past is a huge relief, right? Kind of and a huge value add. And so there's really a lot of stories just from within our own kind of network of customers, of patients talking about, oh my gosh, if you hadn't been here, I would have had to go to the emergency room, right? And so we're really excited about kind of what we're seeing, 12 months, 15 months in. And then some provinces like Alberta have had this in place for a few more years. So there's also a lot of learnings that we can have across provinces where kind of the team has been able to have more experience around kind of minor ailments in that approach.
Yeah, I love that whole idea of this role we can play filling in the gaps, as you said, eliminating costly ER visits, very costly long hospital stays, and all of the angst and that goes along with that. If you're the patient, let's nip it in the bud and address it early. That's our role. So last question. You've got lots of pharmacies, 400 or so pharmacies. You mentioned, we talked about the vision centers, close to, I guess, 200 of those, 72 or so medical clinics in Canada. And you've got a pretty good sample size here. You've seen how this can work. What can the US learn from the Canadian market when it comes to delivering that accessible, affordable, convenient, high quality care?
Really great question. The beauty of working at Walmart is that we're present in so many different markets and we can share learnings and trends that we're seeing in real time, right? Our affiliate in India, for example, Flipkart Health, now they're on an exciting journey to expand digital pharmacy to remote and rural markets. In Mexico, our team did over 1 million patient consultations last year,
Wow.
right? And so healthcare is complex and, different kind of from a regulatory environment in each market. But fundamentally, we're all trying to solve similar problems and looking to establish similar capabilities. And kind of to answer your question, I think the more open we can all be to learning from others, and the faster we can transfer those capabilities, right, and best practices, the better access and consistency in the healthcare experience we can drive for our customers, our patients, no matter how they engage and where they engage with us for their healthcare needs.
Wow, thank you. I think there's a lot more cross-border global knowledge that we can share. I didn't know about Flipkart Health in India and in Mexico. I had no idea that you were that far along. Let's save those learnings for next time and let's do it again, okay?
Absolutely, John. Thank you again for having me.
Alex Hurd, thank you so much. We'll see you next time.